Nick the nurse here. Today we're going to be talking about some of the signs and symptoms associated with the nursing problem of hypothyroidism. Now with hypothyroidism, the patient can have intolerance to cold, lethargy and fatigue, weight gain, anorexia, bradycardia, constipation, hair loss, particularly on the outer third of the eyebrows, hypotension, a thick and dry tongue, periorbital edema, brittle and thinning hair and fingernails. The patient can also have thick and brittle fingernails, so keep that in mind as well. Brittle and thinning hair and fingernails can be seen as well as thick. Pale skin, dry flaky skin, headache, menstrual irregularities in women, depression, drowsiness, memory loss and mental slowing, decreased bowel motility, and that has to do with constipation, joint and muscle pain and weakness, a hoarse voice, as well as peripheral edema. Now, if I was a cruel and sadistic nursing school instructor, and I guess some of my students in the past might have said that I am, no, I'm just kidding. Love you guys, by the way. You know, I would certainly test you and your knowledge on the differences between hyperthyroidism and hypothyroidism, and you need to make sure that you understand the difference between those two diseases or disorders. Now, as I said a couple minutes ago, with hypothyroidism, you're going to see an intolerance to cold. You need to know that intolerance to cold is associated with hypothyroidism as opposed to hyperthyroidism, where the patient's going to be warm all the time. They're going to feel hot. The patient with hypothyroidism is going to have lethargy and fatigue, whereas the patient who has hyperthyroidism is going to be all jittery and moving around and can't sit still. You have to know the differences between the two disorders in order to get your maximum point value on the exam. You have to know that. You have to know that they are going to have weight gain with hypothyroidism, and they're going to tend to be a little bit thinner or lose weight when they have hyperthyroidism, because their metabolism is going to be faster and they're going to be, you know, moving all around and stuff. They're not going to be able to sit still. So you have to know and be able to distinguish between the different diseases or disorders, particularly endocrine ones, because you have your hyper and your hypo. So understand that negative feedback loop and the difference between hyper and hypo disorders like hypothyroidism, and you'll make sure that you're well on your way to passing your nursing school exams, your NCLEX, and go on to achieve your dream of becoming a licensed or a registered nurse. My name's Nick the Nurse. I'd like to thank you for watching this video today. If you'd like to check out any of my other completely free videos, check them out at www.nickthenurse.com, or check them out on my YouTube videos, YouTube channel, Nick the Nurse. Check them out. They're all free. Anyway, thanks for watching. See you next time.